Anybody at all can get kidney disease. However, for people of ethnic minority heritage, as well as those within the socio-economically deprived communities, 1 in 5 people is likely to get kidney disease. That is how high the stakes are, which means that people of ethnic minority heritage are actually at increased risk.
What would I tell the public about kidney disease? It's a silent killer. When I say silent killer, I literally mean that you could have no symptoms until you're at your worst and you need significant intervention from a doctor.
I think a lot of people, they think, if you said I have kidney problems, said, oh, you don't look sick. Yeah, I said it's not a physical illness that you can see. It's a condition you have. You can't see. It's not a broken leg, but that doesn't mean it's not there.
With kidney disease, there are no symptoms until it's too late. So when you're saying to someone that you've got kidney disease and it could get worse, but they feel fine in their bodies, it needs to be communicated better that although you feel fine, this will be the end results, And because I was active, I was going to the gym, I was quite muscular, I was feeling fine. Well, my doctors were saying, your kidneys are not working, but I'm like, I feel fine, I feel well.
I was feeling very itchy. My skin was itchy. It was back home because it was chest stress when I came here. I feel very itchy. I say, what's wrong with my skin? So I go and see the GP. And he checked me, say, you have long-term blood pressure, yeah. He asked me to give my blood test, say, okay. He check it. The day I went to the retest, they say, okay, madam, your kidney is not working well. I say, well, it's right. I didn't feel anything. I said, what do you want to feel? I didn't know there is a link between my skin and the kidney. Yeah, I was surprised, but I didn't really understand what the role of the kidney. And I was okay, I didn't care.
I was the kind of person that kept myself fit, so I couldn't understand why I was experiencing continuous high blood pressure. When I was feeling my blood pressure was getting very high, I was getting more frequent bouts of gout, that I eventually went to hospital. And the woman just said to me, casually, if I remember, oh, do you know you've got end-stage kidney failure?
Communication of the seriousness of kidney disease, I wish it was communicated a lot stronger at the early stages. I might have taken it a bit seriously and prolonged my kidneys.
You have to be brutal. You can't be pussyfooting around and saying, come on, please, come to dialysis. No, it has to, the come to Jesus time saying, you either come to dialysis or you're going to die.
Have patience to explain to us, because it's not our culture to get cancer. We don't know what they call cancer. All we know that somebody kill you, you die.
I remember once I was offered maybe psychological, support in terms of my condition, and I said that I didn't really feel I needed it. All I just really felt was, what I really wanted, if anything, was support from my family. But I think in terms of her profession, it's really listening to that patient and seeing what it is, that they want.
I think educating the family as well is really important, because my siblings do not understand kidney disease, how I got to how I am. They say things like, try acupuncture and you'll be fine, you'll get your kidneys back. And I just sit there and I'm just like, what? How many times do I need to explain kidney disease to you? I feel like they need a lot of, they need to be educated. They need help.
If someone from the leaflet call you, Rosalind, to say, I got this leaflet, it has your name signed on, and would you like to give me more information? Do you have anywhere I can go to get the information I need? Do you have a facility somewhere to direct them? That's what you need to think about first.
Also showing the actual impact of having kidney disease. Like when I read up on it, I'd never thought about kidney disease before. And seeing different stuff that it can affect all of this different complications, sort of showing that it's a serious it's a serious thing. So prevention is better than the cure. So.
Even if you're not getting letters from your GP asking you to come for a general health check, you can make that call yourself, you know, that you'd like to have a full, you know, health checkup, you know, so that if there's anything there, you know, you can capture it as early as possible, and or at least be aware that you may, you know, get X, Y, and Z in the future and know how to deal with it.
You should know that it's better you ask questions. It's better you go for checkup. You are Christian, I know God heals. It didn't mean that you will not check yourself. If you don't see the doctor, you don't go to hospital, you can't be healed.
There's nothing wrong with having a disease. Everyone has something that they have to deal with. So it's better if we come out and we are open about it. And that way, one, you can help other people, and two, you can help yourself, because there might be information that you need that can help you in your journey that you will not receive unless you open up about certain things in your life as well.